Whew. Thank you for that. It's a pleasure to be here. I think what I want to talk about today is patient navigation. As John nicely prefaced, we play a role after, oftentimes when a patient has been scheduled, to ensure that they actually show up to their appointment on time, prepared, and ready to go through whatever treatment, procedure, surgery, or even a routine visit. And for us, it's not just about clinical care, it was also about operational efficiency, because in order to drive patient navigation, it's not just about delivering information, it's about how to deliver information and how to replace a lot of the work that the staff, most of the staff doing manually. So I'm going to go ahead and re-highlight kind of the core problem, one of the core problems we're solving, which is missed appointments, and that costs healthcare system $150 billion each year. That number keeps going up, which is unfortunate, and hospitals are losing money greatly because of this. Now, in thinking about this problem, one of the ways that we thought about it is what's contributing to it? Well, fundamentally, we see a shift in how patient communication, patient-provider communication standards have changed. Now, different word standard there, but you get the idea. Now, in the past, when the volume wasn't so crazy, when life wasn't so busy, written and oral communication was okay. In fact, phone calls, people still pick them up. But now people are busier, both doctors and patients. So they demand a more digital interaction. So what's happening is you see digital portals, text message-based solutions, apps, but still not solving the problem quite yet, right? And we think where this whole movement is going to is automated communication with AI support. Now that's very broad, so I want to dive a little bit deeper into that, but still talk about the present. So thanks to the Pew Research Center, we know that 95% of Americans own a cell phone. That is fantastic, and that number keeps going up. 77% own smartphones, 17% own simple cell phones, but that trend is also shifting. And oftentimes people say, well, that's for young people. What about our seniors, our 65 years and older? Well, 85% of them own cell phones, believe it or not, and this was done in last year. The research was done last year, but gathered over the past few years. So even today, we would probably guarantee that the number is higher. And the split between that is 46% own smartphones and 40% own simple cell phones. And 67% of American seniors use the internet. So it's not really that technology isn't available as the primary issue. It's how do you actually reach these patients. So lots and lots of studies have shown that people prefer text. So that's no surprise. But what we've learned, not just through others' research, but our own interaction with patients, is that texting alone is not enough. So what does that mean? Well, the MGMA research did a study. They looked at patients who missed appointments. And they asked them, what do they prefer in terms of ways to communicate with them? And it wasn't all text message. It was 19% preferred email, 38% preferred text, 24% preferred a phone call. And they didn't ask about paper, but I'm sure there's another percentage of patient who's like, I'd like to see paper, believe it or not. Now, some of the health systems have also been pushing for patient portal. I'm sure you're all aware. There's the MyCharts and et cetera. But unfortunately, only 28% of patients use patient portal across the board. So that's not good. And less than 2% of patients use apps. So now we're left with, okay, how do we fill this giant hole of patients wanting different ways of being communicated with, and different types of patients have different preferences, but then, much to Graham's point, sort of a Moneyball issue where how do we figure out which patient prefers what and how to engage with them through the channel that they prefer. So when we started building our platform, we had three pillars. It was patient-centric, and the way we thought about that was meeting patients where they are. So taking a multi-channel approach, multilingual, and then getting the caregivers involved, because oftentimes, as we know in healthcare, the patients aren't actually personally taking care of themselves. It's someone else, a family member, a caregiver. And there's this notion of provider centricity, which is all about relating to their workflow. And how do we not give them more software to use, but take away a lot of the work that, that they're encountering every day. And then supporting the staff, not replacing them. That's also a common, as John mentioned earlier, there is an important human element in healthcare that you can try to replace, but you probably never will. And there will always be edge cases that rely on human being intervention. And then the last pillar is data centricity. And you'll see probably throughout today's presentation a lot of interesting and innovative ways to use data. But for us, it was about how do you not just share the data with the provider and say good luck, but turn it into action for them? And also, how do you use the data to actually drive behavioral change for the patients? So let's talk about communication strategy, because this is really interesting. When we initially started the company, we were focusing on 1 or 2 channels and trying to perfect those channels. Very quickly, we learned that some hospitals already have a text message reminder system. Maybe they're on Televox. Maybe they have some incumbent solution. And then there's a call center. And then maybe the schedulers are also doing manual outreach. And then you've got a totally separate, underground paper mailing service, sometimes even manual. And they're not talking to each other. So what happens then is the patients are getting bombarded with information from different sources, or maybe sometimes they're even getting different information from different channels. And that's very confusing. So what we believed was that communication strategy needs to be comprehensive. And when we designed the platform, it was how do we allow these multi-channel communication methods to communicate with each other, so that if I'm sending a text message to a patient, then somewhere in the database I know that I don't have to call the patient anymore, or that now the patient actually doesn't need paper mailing and we can save a few dollars, and if you multiply that by a few million patients, that's actually a lot of savings every year. Multilingual, that is something that is being improved over time, but we're still seeing a disconnect between these different channels and how to leverage language and translation. Health literacy, the most underrated, I would say, quality of all of these, still not being done at a way that it's supposed to. And I think part of that is thinking about communication as a whole strategy and making sure that health literacy is one of the pillars. Being flexible, again, we'll get into how to truly adjust your communication to patient's preference, and then involving those who are the primary responsible caregivers. And then on the provider side, so these are some of the reactions that we commonly hear. So the word, I think, takeaway is, or the phrase is thoughtful automation. So oftentimes they'll say, please don't give me another portal. I am so tired of logging into another thing, or managing another, or remembering that I have to do this every day, or dashboards, whatever. Just tell me what I need to do, and don't give me another portal. Reduction of redundant task and workflow. The nurse will say, well, I've made 3 phone calls to the same patients today. I don't think I can handle it anymore. Less manual outreach, less human dependency, less error. Don't just give me the data, tell me what I should do with it. Automate the triage and identification of more critical patients, so an escalation mechanism, so that we do all the automation around routine, regular things, but when we do identify patients who need that edge case human support, that it gets escalated immediately. Allowing for customization. So this is something that blew my mind. And I say it a little bit sarcastically. Every hospital works differently. So you can't really provide a standard communication strategy, unfortunately. There are different preferences from the hospital side that a communication platform needs to accommodate, and then improving operations without more work. Now this, Graham covered a little bit, and I'm sure there'll be others, but there's amazing things that we can do with data these days. And from our perspective, it's about using machine learning not to match patient, because there's experts out there that do that, but how do we use machine learning to figure out how to change patients' behavior? So based on their interaction with the system, based on what communication channel, based on what historic data points. So again, a lot of what John covered today is we as containers also need the types of data that can allow us to actually effectively drive behavioral change. and leveraging predictive analytics, not just to, hey, here's a patient risk. Well, what do I do with it? But to actually say, hey, here are the 3 patients that are edge case patients and high risk that you should call, so that the schedulers, instead of calling 100 patients in a day, they just have to call 3, and that meaningfully reduces their burden and actually modifies their workflow in a way that complements their work and not replaces them. So the following slide, just real quick, some specific ways and examples of how a better patient navigation strategy can actually translate into operational outcomes. So here's an example of, this is more on the referral side because I want to show the full spectrum, but some of the hospitals we're working with were having trouble getting the referred patients to an actual appointment. Now, we weren't developing a scheduling platform per se, but we were able to communicate with the patients who have been referred and put them on one of these multi-channel, multilingual kind of interventions and ask them, hey, when would you like to be called to schedule your appointment, and why, or ask them reasons for why they didn't think that they actually need the appointment anymore. So just gather more information in a patient-friendly way. And as a result, we saw that the conversion rate from referral to scheduled went from 40% to 52% within the first 2 days, and overall, increase as well, all statistically significant. We also saw that in terms of patient reach, before the intervention, it was 54% patients. After the intervention, 95% of patients. So little things, little tiny interventions that drive big results, right? And then reduction and ultimately no-show rate, because we continue to follow these patients and engage them, 5.7% down to 4.4%. Here's another example of what we wanted to do was help resource utilization. So for perioperative medicine and these pre-op centers, they have to triage patients. Well, sometimes they'll bring them in for an in-person visit, sometimes they'll do phone screening, but it wasn't very organized, so that they were potentially wasting a lot of resources phone screening patients who are higher acuity or doing in-person screening for patients who are lower acuity. Completely not the best way to utilize a resource. So we introduced sort of this triaging mechanism, and as a result, we're able to move more patients accurately from phone screening to in-person screening based on their acuity level, and also increase the phone screening rate, which improve efficiency, and we can actually track how much staff utilization, cost saving that translates into. Another example is real-time care instruction. This is probably our bread and butter, so helping patients prepare for, let's say, procedures like colonoscopy, so that they actually show up and they're actually prepared and ready to go. And also providing them sort of timely instructions, logistical support related to their care. Oh, hey, tomorrow you're going to go here. Here's a little link to Google Maps in case you need it. And here's where you park, and here's what you should bring with you. Simple interventions, right? And as a result, and all of these studies have been published, so I'm sure you can find them later. But we saw a 31% reduction in no-show for colonoscopy preparation, 67% improvement in prep quality, and then, of course, continuing to track patient satisfaction as well as engagement rate. And then here's a study with UCSF where we looked at urology, prostate biopsy, same thing, intervention, timed messages, targeting patients based on their preference, communicating with them in a way that's guided, and we saw dramatic decrease in cancellations and even more dramatic decrease in same-day cancellation. All of that translated into, actual financial ROI, right? Here's an example with Mount Sinai Hospital where it was all about preparing patients for their sinus surgery, and it was about both education, so tracking patients' knowledge, and also making sure that the physician and the patient satisfaction are measured. And here's an example of, some of you may laugh, we actually help increase portal utilization because that's one of the goals that the hospitals have. So we say, why not? We'll help send your patients to the portals when they actually need to do something about it, and remind them how to retrieve their password, because that's usually one of the common problems. And as a result, we drove an increase in portal utilization by 230%. So the reason I share all of this with you really is I believe that to change something fundamentally takes time, But I do believe in the meantime, even though maybe a deployment takes 10 years, there are very meaningful things we can do in the short term that will translate to meaningful ROI and help us get ready for a bigger, more dramatic shift. And excited to talk more about that today.
And so again, let me make just a couple of points. So Cerner is a great company with a great product, but is Cerner, given all that it must do to just fulfill the basic needs of getting clinical data gathered and compliance and all the rest, going to focus on who is the best doctor to see you? Well, that's actually a module that Graham provides. Or to make sure you prep properly for your colonoscopy. I mean, again, Cerner does a lot of things. Colonoscopy prep may not necessarily be its focus. And it's a rough problem to solve because, as he's illustrated, each of us has different technological capabilities or even literacy. So how many languages are spoken at Beth Israel Deaconess of the Brigham? I actually know the answer. 37. Right? So how are you going to say, I'm going to get the right information to the person who happens to speak some very unusual tongue and doesn't necessarily have an iPhone? They got a feature phone, or they can receive a text message, but it's not in English. And so all of these things you've heard about are modules wrapping around the EHR that provide these added functions. But let me tell you, and this is where Spencer is going to tell us how hard this is. Remember I just said all it takes is some shipping containers and a crane and a ship. Well, that's good. But you're going to have a tweener period where not everyone has a crane. And here's how bad it gets. We keep talking about the travel industry. It's like, oh, that's just so simple. Well, do any of you know how Travelocity, Orbitz, or Expedia really work? Well, Jeremy Wertheimer, a brilliant software engineer, about 15 years ago, said, do you know that the underlying systems at United and American are actually written in COBOL and were installed by Ross Perot in 1972? And when we say we're going to put APIs around them, like these don't even connect to the internet, right? So what did he do? He wrote 10 million lines of code. And that 10 million lines of code make it look like United, American, and JetBlue have very simple ways to talk to them. And he ended up selling his company to Google, and Google today provides all these APIs, these standard approaches to the industry that makes our experience so simple. But the underlying connections are all a mess of a variety of legacy systems. And so Spencer from Change Healthcare, I imagine, will chat about how they are working to make this sort of innovation ecosystem easier to plumb.